Good evening, and thank you for joining Congressman David Scott's telephone town hall event this evening. We will be hearing from Congressman Scott shortly, but first, I want to let you and everybody know that you can submit a question to the Congressman by pressing star 3 on your telephone. That's star 3 to ask a question at any point during the event. Also, if you would like to subscribe to Congressman Scott's e-newsletter to receive updates on coronavirus and other important issues, please dial star 6, and our staff will help sign you up to receive updates from our office. Now, without further ado, I'd like to introduce you to your congressman from Georgia's 13th Congressional District, David Scott.
Thank you very much, Steve. I really appreciate that, and my heartfelt feelings go out to everyone under the sound of my voice. We are in a very challenging period, but we will overcome this challenge by working together. We have a very distinguished group of participants who are going to bring vital information to you. We want to get as many of your calls in as possible. And first, I want to thank my staff and Chandra and Alfredia and all the people who have put this together. Catherine up in Washington, you all have done a great job. Thank you very, very much. Now, I also want to thank our distinguished panel. Steve, you're going to introduce them and tell our group who they are.
Ladies and gentlemen,
But
first go ahead. Go ahead, Congressman.
But what I want to say is also, we have an awful lot of people. We have a certain period of time. But I want everyone under the sound of my voice to, first of all, take down my office number and my staff. We're going to be in this for the long haul, and we want you to know that you've got a friend, a comforter, and somebody that will be in a position to help you navigate this terrible, terrible, horrific health threat to our health care of our people and our economy. And my office number is 770-210-5073. That's 770-210-5073. We will be here to help you as we move through and navigate a successful overcoming of this terrible tragedy. And so with that, Steve, please introduce our distinguished panel and their background, and then we'll open it up for questions.
Thank you, Congressman. Folks, joining Congressman Scott tonight is Dr. Colleen Kraft, who's the Associate Medical Director at Emory University Hospital. She has served as one of the lead physicians during the Ebola outbreak, so she can talk about how we took lessons learned from there and prepared for this outbreak before we knew even what it was called. She's also overseeing the tests that Emory developed for patients and healthcare workers that gives results in hours compared with the days of the commercial labs. In addition, she is helping to treat current COVID-19 patients at Emory Hospital. Joining Dr. Kraft is Nurse Tanya Vidal. She's a licensed registered nurse. She's serving on the front lines of this fight against the virus. She's board certified in leadership and management, and she's a certified healthcare quality professional through the National Association for Healthcare Quality. Also joining the congressman is Mark Butler. Mark's the Georgia Commissioner of Labor. Mark Butler became Georgia's 9th Commissioner of Labor on January 10th, 2011. Commissioner Butler's goal is to create valuable workforce solutions through strategic alliances and community relationships. In order to better serve Georgia's job seekers, Commissioner Butler has created the Special Workforce Assistance Team. The team has been designed to do job readiness program to help unemployed and underemployed people better market themselves to employers. Prior to taking office, Commissioner Butler served 8 years in the Georgia General Assembly, representing House District 18. For more than 20 years, Commissioner Butler worked with his family small business in Carrollton. And finally, the Congressman is delighted to have Mr. Ashley Bell. Mr. Ashley Bell is the Southeast Regional Administrator for the USSBA, the Small Business Administration. And Ashley was appointed on February 21st, 2018 by the White House to serve as the regional administration for the USBA for Region 4, serving 9 districts located in 8 southeastern states of Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. Mr. Bell's oversight has over $5 billion in SBA-backed lending, the counseling arm of the SBA, which counseled over 225,000 entrepreneurs last year in Region 4. As a small business owner and entrepreneur himself from the age of 22, Mr. Bell is committed to the SBA's mission to aid, counsel, assist, and protect the interests of small business concerns, to preserve free competitive enterprise, and to maintain and strengthen the overall economy of our nation. As Congressman said earlier, it's a distinguished panel that is joining him this evening. Congressman, any final remarks before we get to some questions?
No, let's get right to the questions.
So, Congressman, first, Carolyn, she wanted to know what protective measures are in place for United States Postal Service employees.
Well, I think that, hold on just a second. Catherine, I think that we have put some things in here for that, and we're continuing to do so. If you might look and see specifically what are the protective measures that we have in, and I might add that this is an important issue for us. They're on the front lines as well, and it's been called to our attention, them as well as the TSA agents. We're making sure that they have the proper mask, the proper equipment, and we want to take care of our postal workers. Catherine, do you have any specific on that, or anyone else on the team?
Yes, sir. This is Catherine. So Congress did recently take some actions to ensure proper protections for postal workers and the Postal Service generally. This includes a $10 billion emergency loan from the U.S. Treasury to help the Postal Service survive this economic downturn amid the additional challenges that are placed on them by the crisis. In addition, understanding that the social distancing practices have placed strain on USPS's ability to perform its duties in normal course, they have established alternative delivery points to help safely address to help safely reach all addresses, and also prioritizes the delivery of medical supplies during COVID-19, so that we can be sure that those frontline entities that are in need of medical deliveries are receiving those in a timely manner.
So for all those that are joining the call right now, this is a live conversation with Congressman David Scott, who's got a distinguished panel. If you'd like to ask a question tonight, simply press *3 on your phone. Just as people are joining us, we can get everybody a chance to give a proper introduction. The Congressman is joined by Dr. Colleen Kraft, Danya Vidal, Mark Butler, and Mr. Ashley Bell. Folks, Dr. Kraft, can you just take a moment, tell us a little bit about what you see going on and some perspective from in your position as Associate Medical Director at Emory?
Yes, I'd be happy to. And I think just for the group, I wanted to let you know that the Department of Public Health has a website where they have the daily status report. So if you would like to kind of have a good source of truth to go to figure out what's happening in our state, I suggest going to that website. It's dph.georgia.gov. And today we've had 7,000 cases in the state of Georgia. About 20% of them have been hospitalized, and we've had 229 deaths. And so I think that's just a good place to anchor us every time we're sort of trying to think about what to do next and what our response should be. What we're seeing, at least in the last week at Emory Healthcare, is we've just seen basically a plateau of our cases. And so we're sort of waiting to see if this surge that's predicted in the next 2 weeks is actually going to happen, or if some of the measures that have been taken at the county and state level will have made a difference. In terms of what we're seeing clinically, we are seeing people that require to be in an intensive care unit and people with viral pneumonias, which is something that's pretty unusual for most respiratory viruses.
Thank you, Dr. Kraft. Also joining us is licensed registered nurse Danya Vidal. Danya, your perspectives from what you see going on today.
Thank you. And I just want to say thank you to Congressman and also thank you to the staff for organizing this town hall meeting so that we can share some truly life-saving information. From the nursing perspective, the primary thing that has been what's a little different with COVID-19 patients compared to some other respiratory illnesses that we've treated previously is kind of the sharp decline that we see. We can have a patient that's in the room and they're talking and speaking with us, and by the end of that shift, we are having to perform life-saving measures. And so I think that probably is what is more concerning than anything that we've been seeing is at the bedside is somewhat of more of a rapid decline. But I will say that for all the stories that we hear about patients who come into the hospital and unfortunately don't make it out, there are many patients who are recovering, many patients who come in with symptoms and they're symptomatic and struggling a little bit from a respiratory perspective. And the things that we're doing and the measures that everyone is taking, they are coming out of the hospital, and there are some definite success stories. So I just want to make sure that to put that out there, that while this is very concerning and a lot of, I think, struggling from the perspective of having proper PPE and those kind of things that you hear in the news, there are patients that are recovering.
Thank you, Danya. For everybody who's joining us now, we are joined on Congressman David Scott's town hall regarding the coronavirus with a panel of guests. Dr. Kraft from Emory University. You just heard from Nurse Danya Vidal. Congressman, also joining you this evening is Mark Butler, who's the Georgia Commissioner of Labor. Mark, go ahead with what you're working on right now.
Well, what we've seen really here in Georgia in just the past 2 weeks is an unprecedented amount of unemployment claims. To give you just kind of an idea, 2 weeks ago we did have a fairly large surge of unemployment claims. We reported that we processed 133,000 claims. In last year's time, it would have taken us 6.5 to 7 months to actually accumulate that many claims, and we processed all those in 1 week. And it appears right now that when we get the full amount of claims that were filed this past week, we're probably going to be showing that we had more claims filed for unemployment in this last week than we saw in all of last year. So our staff right now is working very long hours, and I give them a lot of credit for being able to get a lot of these claims processed because the Department of Labor has never processed as many claims in this shorter period of time. And so be thinking about them as they are taking away time from their families in order to help families across Georgia right now as they're working not only long hours during the work week but also on weekends too, because we know folks are struggling right now and they're needing this additional help. And speaking of additional help, we just received information this past weekend on the new rules and regulations for the additional federal unemployment that was passed in the CARES Act. We just received guidance, which is what we've been waiting on before we could actually administer these new benefits. So we have got that guidance now, and we know what it is that we're going to have to do to change some of the programming in our current system in order to provide this additional funds. And I have gotten word today from our IT division that once we put in the additional requirements that USDOL has asked us to do, those individuals who are currently already receiving or going to be qualifying for state unemployment benefits, we will be able to add the additional $600 per week by this time next week, including all back. We'll start putting that money out starting this time next week. We won't get all of them all in one day, but that's when it's going to start, plus any back week that they were due, which would have been last week's claim also. The big lift is going to be the unemployment for those individuals who are currently not in the unemployment system, and this would be your gig workers, 1099, self-employeds. We did get that guidance late yesterday evening, and we have been working on that. We're also working with our partners in Georgia Department of Revenue to help us access the information we're going to need to make it as easy as possible on Georgians that are in this situation to be able to file. We're still efforting some solutions on that to make it as easy as possible because we know not everybody has access to a way of scanning documents and things like that. So we're hoping to be able to do it through digital means to where we can just go access some stuff that's already out there. And so it's probably going to take a little bit longer than a week to be able to get that efforted up. But from what I'm hearing right now from other states, we're going to be able to implement these new programs much faster than other states around us. Matter of fact, I'm hearing some states are saying they're not going to be able to do this for 4 and 5 weeks, maybe even a month, because of the requirements in the computer program. The good news is for Georgia, we do all of our stuff in-house. We're not waiting on a vendor. And so our folks have been working on this right away. So that relief will be coming soon, and I would just tell everyone to please be patient. We are seeing phenomenal amounts of phone calls, emails, requests for help, and we're trying to get those. When you're talking about 1,000 total employees throughout the entire state, and we're seeing some days 60 to 80,000 phone calls. So they are working very hard to try to get to everybody when they can. But just keep looking at the website. We've added a lot of features to our website, a lot of ways you can check on your claim, a lot of ways you can do some things that you could not do until this week. A lot of features that we've added that we weren't going to add until later on this year have been added to where you can do a lot of self-service right now. We also added a new automated system. So my IT guys call it a bot. I really don't know what that means, but it's a way that you can go in there and you can ask questions, and it will pull those answers from our different documents and help you find those quicker. That system has just started today, and it's going to get better with the more questions that are asked. So just to let you know that we are working very hard at the Georgia Department of Labor on all sides to get this additional monies to Georgians around the state. And so just hang in there, and we're going to get this assistance to you as quickly as possible.
All right, folks, for the thousands of you that are listening on phone and watching online, you are live right now, Monday here, April 8th, a little bit after 5 o'clock with Congressman David Scott. And for some sense of his panel, folks, Dr. Kraft from Emory University, a nurse, Danya Vidal, who's on the front line of this fight, Commissioner Butler's here to talk about unemployment benefits, and then finally from the White House and in charge of the United States Small Business Administration, Mr. Ashley Dahl. Ashley, any comments for the folks here in Georgia listening tonight?
Thank you, Steve. I want to first thank Congressman David Scott for this opportunity. Continuously, your leadership has been exemplary, and your customer service and constituent services are second to none, and I think this call is an example of that. So thank you for your leadership. Thank you to your staff. I want to jump right into this and just talk about how important it is right now for everyone to stay safe. And I want to, give my heart out to every small business owner out there who is struggling to find a way out of this and to keep their doors open. So I hope what I'm about to share with you are some tools of which you can use to begin to recover. As a small business owner myself since I was 22, I know how hard this is. And so when we look at two major programs that are available, I want to jump right into the disaster program. We have a program called the EIDL loan, which is directly through SBA. So if you're looking to take advantage of this program, it's through SBA.gov. This program is very important. The only reason we're able to access these funds is because Georgia worked very quickly. My office worked hand in hand with Governor Kemp to get Georgia declared a disaster before any other state in the Southeast. The very first monies that came out of this fund came to Georgia businesses, and it's been a very good partnership. So what this EIDL loan does, if you are a business or a nonprofit and you have over 10 employees, you can go on SBA.gov right now and you can apply for an EIDL advance and a EIDL loan. So let's just give you an example. So if you apply for a $50,000 EIDL loan and you have over 10 employees, we can get you $10,000 in the first 72 hours. That's $10,000 in the first 72 hours while the rest of your loan is processed. Well, that $50,000 loan shrinks down to a $40,000 loan because that $10,000 is forgivable. That is yours. in whatever event, if you were not even decided, if you decided not to take the loan or were declined, you still keep that $10,000. And that's an important fix for people who need the money right now. This EIDL loan is important, and the rates on it are 3.75 for a for-profit business. If you're a nonprofit or you run a nonprofit right now and you're listening to this, that rate is 2.75. What's great about this loan is that you do not have to pay back the first payment until 1 year after the note. So that gives you a year for us to get out of this hole, to recover before you have to make the first payment. And on top of that, we can stretch that loan out up to 30 years. So it's an incredible tool to plan out what's next for you and your business. Now, the other program, which is extremely important that I know so many of you are hearing about, Friday of last week, we started the Payroll Protection Plan, which is a key part of this administration's effort to get people back to work. And I think, Commissioner Butler talked about the outstanding just numbers that we're seeing out there as far as unemployment. This law was created to get people back employed and to get people back on a payroll. So this Payroll Protection Program, as of Friday, if you're a business that has employees, you can go directly to your lender. You can go to a lender that does SBA loans. That's where you want to go. If you would go to your lender will look at your average payroll for over a month. They look at your monthly payroll, and they won't look right now. They'll go back to last year when times were good. We'll take your average payroll, multiply that times 2.5, and then you'll take that number and be able to pay your employees for the next 8 weeks and cover your rent, mortgage interest, utilities, and insurance. And if you keep a bargain with the federal government saying that you will keep your people employed for 8 weeks, and even if you have to hire back folks you let go, if you keep them employed for 8 weeks, that entire loan becomes forgivable. The entire loan becomes forgivable. So that allows us to put people back on the payroll, but also allows us to make sure you don't incur more debt under that circumstance. If you currently have an SBA loan, if you currently have one, then now that loan will be paid by SBA for 6 months. We'll pay your principal, we'll pay your interest. That is 6 months of SBA paying that loan, and that is due to the CARES Act that had bipartisan support, supported by this congressman. So it's an extraordinary effort to bring people together and being able to get people back on a payroll. But here's an important announcement I want to make because it's so critical. Many of you know how important our small businesses are. But what's even more important at the end of the day is making sure our culture is preserved and our way of life and our faith. So today, SBA has expanded the rules. And for the first time, every church in this district, in the congressman's district, is going to be eligible for payroll protection. This means every church, every synagogue, every mosque. If you have a church that has been hit by not being able to gather and worship on Sundays, by not having the ability to have online donations, and you and I know how critical that is to so many of our institutions of faith, they now are eligible for payroll protection. So if you hear this for your business, call your pastor when you get off this call. Call your worship leaders. Let them know they can go to their bank and apply for the same payroll protection that 4 businesses can apply for. Faith leaders can do the same. It is an incredible tool that we can use to make sure our churches are available to be there for us through this time and are there for us afterwards. And so with that, Congressman, I'll open it back up to you and the moderator for questions.
Well, Congressman Scott, we've got a lot of folks that have a lot of questions. You want to get started here and hear from your constituents and what they're wondering about?
Yes, I do.
All right, sir. First, this is probably going to be back in Mr. Bell's wheelhouse. He's asking, what are you doing to encourage small businesses to apply for the SBA benefits?
Well, the first thing I'm doing is joining this call to make sure that people know about it. But I can tell you that it's a partnership to get the word out. And what are we doing to encourage it? I'll say this. With the state of Georgia, we have a partnership with the small business development centers that are all over the state of Georgia. I think Clayton State's in the congressman's district where we have an SBDC. Obviously, we don't want people running to the bank or running to the SBDCs for health reasons. We don't want anybody gathered. But all these institutions have phone numbers and they have email addresses that you can find. The Small Business Development Center in Clayton State is on our website, as well as around the state. There's 17 different locations. But I think the key is we're going to need help getting the word out. And I ask everyone on this call today, as much as you hear the word about your business or you hear about the other issues we're talking about, we need our faith leaders to know this is an unprecedented lift, unprecedented opportunity. Most of our churches have no idea that they're able to take advantage of this. So we ask for your help to spread the good word, and you can reach back out to SBA, find information from us at sba.gov as well.
Folks, so listen,
also,
Congressman put together a big panel of folks here to answer questions. That's Ashley Bell from the Southwest Regional Administrating's oversight over the USBA from the White House. We also have Commissioner of Labor Mark Butler on. We have Dr. Kraft, Nurse Vidal. We got a lot of folks to get to. Congressman, one of the next questions up is from a person who has had some flu-like symptoms a few weeks ago, still has some tightness and having a hard time, but the doc said it wasn't the flu and he's concerned. How can he get tested for the COVID-19 virus?
Dr. Kraft, could you respond to that? You may have, you're on the state panel.
Yes, and thank you very much for the question and the opportunity to answer the question. And so I think the quickest way that I can tell you to get testing is to call 404-71-COVID, and that is a line that's staffed at Emory until very late evening that can help direct people to find the best place to get testing.
Dr. Kraft, what's that number again?
404-71-COVID. which if I look on my phone, it's 404-712-6843. Probably have that memorized.
Okay, thank you. Thank you, Doctor. Okay, so folks, listen, tonight, Congressman wants to get as many questions as we can, so we're going to get as many folks on as possible. Marvin had asked, do senior citizens collection Social Security automatically receive the stimulus? So, Congressman, do senior citizens collection Social Security automatically receive the stimulus?
Yes. My first answer to that is yes. I want to make sure, Catherine, that the language does guarantee that for our senior citizens. Am I right?
Yes, that's correct, Congressman. So low-income taxpayers, senior citizens, folks on Social Security are all eligible to receive the individual payments. And as long as you're receiving your Social Security benefits through direct deposit, that's how you should expect to get your stimulus check as well.
Okay. Now, while we're on that, Steve, I think that it might be opportune for me to talk very briefly about these stimulus checks that everybody within our call will be receiving. This has been a wonderful effort to make sure that we can help everybody, every American citizen, with some immediate cash shortages to help them to do that. And we really appreciate the bipartisanship of this. Many of you have probably heard the president letting you know that there will be checks coming out. Let me be very brief and precise here, but everybody, please listen to me, because this is where and how you get the certain amount of money. Adults who will earn $75,000 or less will be eligible to receive up to $1,200. Married couples with no children who earn $150,000 or less will be eligible to receive $2,400. Taxpayers who file as a single-parent head of household who earn $112,500 or less will also be eligible to receive the full amount of $1,200. In addition, each child dependent, by that we mean under 17 years old, will receive $500. And what I also want to say about this is that if you, as someone recently called, If you're receiving Social Security, if you're receiving disability, and you're not required to fill a tax, low-income taxpayers, senior citizens, Social Security recipients, some veterans and individuals receiving disability who are otherwise not required to file taxes are still eligible to receive payments. The IRS has stated that all you have to do is to make sure you file a simple tax return. If you have filed your 2019 tax returns, wonderful. You can get direct payments right to your account. If you have not filed 219 and you have filed 218 tax returns, the same thing applies. In addition, we in Congress have extended the tax deadline from April 15th to July 15th. Now, I also want you to know, while I'm on this, very important, we got some bad actors out there who are taking advantage of this national crisis and trying to trick consumers out of this money. So listen to me carefully. The first thing you need to know, do not provide any personal information over the phone. If somebody calls you and suggests to you that they can assist you in receiving your repack, your check, if you verify certain of your information with them, hang up that phone. They may even say to you that they need you to provide your personal information in order to release your funds. Do not provide any information. Know this, the IRS, who will be sending out these checks, does not initiate contact with any consumer, any American citizen, by phone, email, text message, Social Security. So beware, they're out there. The scammers are out there. Do not give out your bank account, debit account, PayPal account, anything. There will also be people who will be calling you and telling you that you ain't got your check yet. Well, let me help you. I can expedite that process. Pay no attention to them. The IRS is working to get these checks out as quickly as possible. There is no process where anybody can jump the line. So if you receive a call or an email offering to expedite or request an exchange for your personal information for a processing fee, it is a fraud. Stimulate checks are free. You don't need to spend any money to receive them. And finally, do not click on to any suspicious links. If you receive emails or text messages from suspicious or an unknown address, quickly delete them. Don't respond. Do not click to any links. So put on that whole armor to protect yourself. You don't have to worry about contacting the federal government for your checks. We know. We go by your returns. The IRS does not contact anybody. And we want to make sure you get these stimulus checks. Meanwhile, I gave you my office number at the very beginning. If you have any doubts, if you need any information and help in getting your stimulus checks, you call David Scott's Congressional Office, 770-210-2222. 5073. That's the number to call if you have any questions about any of this. We're the ones that can put you in touch with the answer to your question. Thank you.
Folks, as you know, that is your Congressman David Scott. Again, that phone number for your regional office is 770-210-5073. And you're joining live Congressman's Town Hall with a panel of folks to help with healthcare questions, which is what we're going to talk about next. Congressman, Daphne's asking a question that a lot of folks are asking both in your district and around the country that she's posed for Dr. Kraft and Ms. Fidel. Should we be wearing face masks? Dr. Kraft?
Yeah, so I think our thinking about this has changed over the time of these discussions. So a face mask inherently doesn't fix the transmission for you, but I think people are finding that it is basically a way to say, I'm trying to stay away from getting infection from you or from other people. I think the main things we do need to remember, in addition to wearing a face mask, if you feel more comfortable wearing one, is very good hand hygiene, very good face hygiene. I think for some people, the mask helps with face hygiene. For myself, actually, I find myself touching my face more to adjust my mask than not. And so I think it's really important, again, face hygiene, hand hygiene, and not touching surfaces that you haven't cleaned. Those are the main things, I think, to prevent transmission. Wearing a face mask, I think, when you're out in public and in general, probably won't make any difference, except it may help others know that you're taking it seriously.
And this is Dania. I'll add to that as well that as far as the masks are concerned too, that if you choose to wear a mask, that be careful when you are removing the mask and when you're placing it in other places. So when in the hospital setting, when we take off a mask, we use hand hygiene prior to taking the mask off so that we make sure we are, because at that point we're bringing our hands to our face, right? So, and the encouragement, as Dr. Kraft just mentioned, is to try to keep your hands away from your face. So as she mentioned about adjusting the mask, in the hospital setting, before we remove our mask, we perform hand hygiene and wash our hands. When I am out and about and see people out in public, I don't see that happening. There's just taking off the mask and sometimes just putting it down somewhere. If you're truly using that mask to protect yourself and you're thinking, I'm protecting myself from droplets or anything out in the community that is airborne that might get onto me, and so therefore I have this mask on, then the outside covering, by that logic, can be contaminated, right? So if we just reach up with our hands to remove that mask, and then place it down in our car or on the kitchen counter when we walk in the house, then we could, by that logic, be doing some cross-contamination. So if we are going to wear the mask, please make sure to use that proper hygiene when you are removing the mask. You want to take your mask off. You want to put it down somewhere where you're not going to put contaminants somewhere else, and then perform hand hygiene again. And removing the mask, making sure to minimize as much as possible you touching your face.
Well, that is sure helpful. I haven't heard that, so Dania, thank you for telling us that. That's a good way to go about how you're touching the things that you're using to protect yourself. Congressman Kayla, she had a question that I think is going to be in Commissioner Butler's wheelhouse. How long does it take to get unemployment benefits approved?
Well, there's not a really simple answer to that, but to kind of give you an idea, in a normal time before all this happened, let's say that you were laid off from your job or something happened, and you applied for benefits. If you go through the normal process of filing your benefits, information getting to us, sending requests to your employer in order to get any kind of information from them about your employment there, give them also time to dispute anything, it would take up to 3 weeks. However, in this particular case, we have done a lot of work towards streamlining a lot of this for individual filers to get them their benefits faster. And also something else that we did very early on, it's been almost now 3 weeks ago, we put in an emergency rule in place that required employers in the state of Georgia that were going to be laying off due to the COVID-19 crisis to actually use a system that's not unique to Georgia, but only a few states use it, a partial claim filing system, which means that the employer files on behalf of you, and you are still their employee, but you will not be getting paid, so you will be getting unemployment benefits, and they're already attesting to all that information that we would normally have to wait for. Those types of claims can be processed not in 21 days, but just in a few days. And so we've been pushing employers to use that system so we'll have all that stuff ready to go and expedite these claims, which has been one of the big reasons why we've been ahead of a lot of other states when it comes to processing claims. Just like I said earlier, last week we processed over 130,000 claims. This week it looks like we're probably going to exceed over 400,000 claims that we have actually processed. And so once that happens, and then there's a little bit more wait for the money to either get to you. If you don't have it set up to direct deposit, you do have to wait to get the card. So even though it seems like some people are having to wait a very long time, that just got hit in the last couple of weeks, actually, in reality, we're actually making this happen a whole lot faster than it normally would. However, if there are some issues with somebody's filing, say, for example, that we have had a lot of people either double file or we have had employers incorrectly upload some stuff, there are going to be some issues there that can hang things up, or if there's some other issues in somebody's individual file. And I know that it is difficult to get in touch with us right now because of the excessive amount of emails and phone calls, but keep trying and also reach out to us on social media. There's several different ways that you can go on there. Plus, there's a lot of self-service that you can do online to check on on your claim. Now, if your claim is showing that it's processing, you haven't received something negative, really, then that's exactly what's happened, and it's being processed. So, don't call in and say, "Hey, you're saying process. What's going to happen?" Just be patient. That means that things are going well, and you're on your way to getting your unemployment benefits.
Thank you, Commissioner Butler. Listen, folks, this is a conversation that's live with Congressman Scott, who's brought together quite a panel to be able to answer your questions, both about the virus and its impacts on our health, and also how it's affecting our jobs, and also how it's the stimulus is intended to help out. And so with that in mind, Congressman Paula had a question. What help do homeowners have for mortgage problems? So homeowners, what can they expect for help with any mortgage concerns that they're having? Congressman or Mr. Bell?
Yeah, Mr. Bell, why don't you go first, and then I'll follow up.
Thank you.
Catherine.
Go ahead, Catherine.
For assistance on mortgage, Congress has taken some steps to allow homeowners that are in federally backed housing, so FHA, VA, USDA, or if you have a mortgage that's owned by Fannie or Freddie, you can apply with your mortgage servicer to receive forbearance, which is basically like a pause on your mortgage payments. And so you can apply for an initial period of up to 6 months, and then reapply for 6 more months after that if you need it. And this allows homeowners to access that payment relief if you've experienced job interruptions or are having difficulty making your payments during this time.
And I might add to that, that is not enough. We're not doing enough in that area. So I have introduced legislation. It's, I believe, will be added into the 4th branch, and that is $35 billion that we want to put in. So each of the 50 states, including and added to the District of Columbia, Puerto Rico, Guam, and the Virgin Islands, and it will come down to the states. The states will have that money to help struggling homeowners pay their mortgages so they can get to the banks, so we can keep our banking system alive, because that's how the banks make their money, And most of this is coming from smaller banks, the community banks, some of even our credit unions. And they rely on those mortgages being paid. So we will do that. In addition, we need to make sure that the utilities are paid. When you have people at home, we got 12 million people right now without jobs, an unemployment rate that is unprecedented. We don't know when that's going to end. And this $1,200 or $2,400 that we're sending out is not sufficient. And so we want to put, many of us worked on that when we had the other crisis under the Obama administration. We were able to bring $339 million. Some of you may be under the sound of my voice. You may have been recipients of that, where we were able to get mortgage payments done. And now we want to add the utilities to it. Because if we're telling people to stay in their homes, we got to make sure they have a home and can keep that home. And if we're telling them to do that and they have no income coming, we need to make sure we have money there to pay the water bill, that light bill, and that gas bill, the utility. So we got that. I've introduced that. I hope we can get that in, because what Catherine just outlined to you is only applies to federally backed mortgages. If you have Fannie or Freddie or the FHA, then fine, you get a little bit of that help, but you have to repay it at a certain time. So hopefully we'll get this in. We're moving in it, and but that's an area. We got to keep our folks in their homes, and we got to keep their water and their light bills paid.
So, Congressman, one of your constituents, Gregory, has an interesting question that's kind of in line with that I think you'll get some help with the folks from the SBA on, is that in this economy right now, folks are having to pivot and figuring out how to modify their business models. And an example is, rather than having dining room tables, that you have to pivot and offer carry-out. Any key items that some small business owners can consider in modifying their business model given this current environment and the situation that's in front of us?
Absolutely. I think that, the crux of it is we want to offer you tools to make sure that your former waiters and your former folks that were cleaning the tables can now do takeout or help with takeout, prepare takeout orders in that instance. So we want to help you be nimble. And counseling is a big part of what SBA does. We counseled over 250,000 people last year. And again, we do our counseling through a partnership in Georgia with our university system of Georgia. So you can get counseling through your Small Business Development Center free of charge. You don't have to pay for that. So don't let someone tell you they can offer you consulting to figure this out. We put that money was put in the bill through the Congressman's efforts and others to have additional funding so that these small business development centers can offer the resources to all the small business owners out there that need it. And these are experts. These are people who have been there and done that before, who know how to adjust in different economies, and they can help you figure out the best way to maneuver during this time, and also help you navigate the different programs that we have that we talked about earlier, either our EIDL loan program or the PPP program.
Thank you, Mr. Bell. Next, we're going to go, Congressman, for the folks that are in your healthcare roundtable here. A question everybody's asking: what is Georgia's projected peak for COVID-19 crisis? Dr. Kraft, any speculation on when
Yep.
folks are modeling out when they think this is going to be at its peak?
Yeah, I think it's a great question. We often feel like we're looking in a crystal ball, and it'd be really hard to predict. If we were on the same time frame as New York has been, and it's been really, really tough for them on the East Coast, then we would continue to see some cases climbing. And so we have over the last week seen sort of a little bit of a flattening of the curve. We feel like we may be being optimistic, falsely optimistic. But with all the models that we've seen, we project that the peak would be within the next 2 weeks. And so healthcare systems, outpatient systems in general, have been really preparing for this from a medical standpoint for at least a month now. So we're hoping that we will be able to meet that peak with enough resources in the healthcare system to be able to get us through that to the other side.
And Nurse Vidal, maybe you can share with the impact and overload of what's happening in our hospitals locally.
Yes, locally what we're doing primarily, because we have not hit that peak yet, many of the hospitals right now, and I think this is probably for most of them, we are all making our surge plans. And the surge capacity is really where we are looking at what happens when our ICUs get full. Most hospitals right now are creating alternate care sites throughout the hospital. We're looking at trying to figure out how can we safely reduce nursing documentation so that the nurses can focus on providing that care at the bedside as opposed to charting in the computer if it's not as necessary and critical. We're looking at alternative plans to make sure that we have enough PPE. We're looking at plans for making sure that we don't run out of medications such as paralytics and analgesics, those things that are the critical, we call them critical drips. These are medications that are used primarily for patients that are on a ventilator. And we're making plans to make sure that when we hit that surge that Dr. Kraft is referencing, that we have the human and physical resources that will be necessary to take care of those critical patients.
Good. Thank you for that. Congressman, any comments?
Now, let's see if we can get a couple of more questions in.
Yes, sir. So kind of a combo question, and I think this is going to be for Commissioner Butler from both Jay and Michelle, who are paying attention online. Jay had asked if a self-employed person applied last week, should they reapply after April 10th or keep the current claim open? And then on top of that, was there guidance provided for individuals that don't qualify for state employment due to the lack of work history and earnings? So Commissioner Butler, can you tackle both of those? First one was Jay's about keeping his claim open if he had to file again after April 10th.
Well, I got the first part. Could you repeat the second part of that question?
And the second one was for individuals that don't qualify for state unemployment due to lack of work history and earnings. Is there some guidance for those folks?
Okay. Now, on the first one, just leave your current claim open and keep checking back on our website. When we get it all figured out how we're going to gather your information, and we're going to try to come up with the most simple solution that we can to make it as easy on everybody as we possibly can. So keep that open, and we will be notifying you, and also we'll be putting something on our webpage. So keep that out there. Now, for other individuals, there are some other things that are going to be happening out there who don't have all of, or don't quite have enough work history. There's going to be some other possibilities for them also. And that's also, you need to be a little bit patient, wait, because we're still working through a lot of different guidance on different things that we just received. The big chunk of it we just received last evening, and all that's going to be posted on our website, and we're going to have, different postings for the different types of individuals, how they're, and how they're going to be affected by this.
Thank you, Commissioner. Folks, we're going to do one more question before some closing comments tonight. Thank you for doing this. And again, the Congressman has done everything he can to pull together a panel to best represent all the questions that folks are asking of all of his constituents. But we're going to go to Diane. Diane had a question about seniors needing food. Is there a list of places that seniors specifically can go to get food, and specifically if anybody has any insight into Clayton County?
So, Congressman, this is Catherine. I'll chime in here. There are options for low-income seniors to get meal delivery through Meals on Wheels, and if you are looking to connect with that service, you can dial 404-351-3889. In addition, there are a number of other options for constituents to receive access to meals. For students, many local schools are providing meal pickup options, and Georgia has also expanded SNAP benefits to provide those families on SNAP with access to more resources for food security. If you are looking for a meal distribution location, you can also call the Atlanta Food Bank, and that number is 404-892-9822. So hopefully that answers your question.
And also, I might add, some of you may be familiar with what we call the WIC program. That has been expanded. WIC stands for the Women, Infants, and Children's Meal Program. Has also been streamlined under this act. Which I mean by that is the Secretary of Agriculture, Secretary Perdue, can grant waivers allowing participants to be certified to receive benefits without even having to be physically present. And the state of Georgia must request this waiver from the federal government in order for it to become effective. And the other thing is, because the Atlanta Food Bank, who are one of our really strong partners, I've been working with them for over 30-some years, they partner with the organizations, food organizations all across the region to provide food resources for our people right here in Georgia who are food insecure. I don't want nobody going hungry. Now, there is a number that I want to give everybody so they can find a food pantry nearest you. I think the caller who had that question mentioned Clayton County. If they would call area code 404-892-9822, that will help you find a food pantry who is nearest to you. And as Catherine just mentioned, Meals on Wheels provides meal deliveries for all low-income seniors. For that, if you're a low-income senior and you need somebody to bring you a meal from Meals on Wheels, call this number, 404-351-3889. In addition to that, many of our local schools are providing meal pickup options for students. So we have a whole lot of things going on. But if all else fails, that's why I gave you the number of our staff. That's our job, to help you, as I said before, navigate this. Chandra Harris is my district director, and she does an extraordinary job. Chandra, I think you're on this call. Would you mind giving them how they can absolutely reach you and how you would help any and everybody? If you need food, you call us. Yes. Call Chandra. Go ahead, Chandra.
Yes, sir. So if there's anyone on our telephone town hall tonight who needs assistance feeding yourself or your family, please do not hesitate to call our office at 770-210-5073, and our staff members in both our Jonesboro and Smyrna offices will be happy to assist you as quickly as possible.
Thank you. And also let me add now that emergencies come up. There are things out there, as my granddaddy told me, David, always don't just look down the road, but look around that corner, see what's coming. And we don't know exactly what's coming, but we know something is coming. We can't define what it all will be. So that's why I'm saying call me, call us at 770-210-5073. If you have trouble, somebody won't cut your water off, your electricity, until we can get this bill enacted, and if we do, it'll be July before we can even get this going. We don't need any utilities cut off. We don't need anybody being foreclosed on. Anybody with those essentials for your survival, if you see them being threatened, you call David Scott's Congressional Office, 770-210-5073. Our staff will be there round the clock. We will not turn your hand loose. We're in this together, and we will overcome together with God's help and our prayers and our faith.
Folks, that's our Congressman David Scott. Let's get to all of our panelists, and then we'll say good evening. Mr. Ashley Bell, appointed in February 2018 by the White House to oversee this region for the SBA at a federal level. Mr. Bell, some closing comments.
Thank you again for allowing me to be here, Congressman, and thanks again to your wonderful staff. Chandra Harris has been phenomenal. We all know the great work that she does around the district. I just want to say to folks out there who have a small business or who have a gig, you know, this is an incredible time, but we are incredible people. And I want you to look at the tools we've talked about today and use them wisely. The federal government, with leadership in the House and Senate, with Congressman Scott being one of those leaders, has provided an enormous amount of federal support to help you with your small business, loans and grants that you don't have to pay back, ways of getting people back on payroll so we can decrease the amount of unemployment, and help for your churches and for your faith, places of faith. So please spread the word. If someone from your church wasn't on this, call them, let them know. Say, Pastor, we have an opportunity. We can get through this. The tools are there. And God bless everyone on the call today. Thank you again, Congressman Scott, for the opportunity.
Thank you, Mr. Bell. Thank you for your leadership. Commissioner Butler, as you all know, he's the Commissioner of Labor, and he is the person who's in charge of paying attention to all of these unemployment claims and all the things that are going on amongst all of us. Commissioner Butler, some comments before we say goodnight tonight.
Well, just quickly, thank you, Congressman Scott, and your staff for putting this together. These are the types of things that are helping us at the Department of Labor get the word out, where to look for the information. Right now we need all the assistance we can to help us keep Georgians informed of what's going on. And I would just say that for those of you out there who apply for unemployment waiting on it, we are working every day to get your claim processed and through and get you the funds as quickly as possible. And we're trying to actually make this happen even faster than what it would if none of this was going on. So even though sometimes you feel like you're waiting forever because we're all used to that, I call it the Amazon mindset, where we order it today and it shows up tomorrow. Unfortunately, this process does take a little bit longer, but thank you again, Congressman Scott, for putting this forum together to helping us keep your constituents and my constituents informed of what's going on.
Folks, that's Commissioner Butler, who's served as the 9th Commissioner of Labor since January 10th of 2011. And look, the Congressman made sure tonight that we also had good representation for folks in the medical field. And I thought that personally that Nurse Tanya's comments about masks was extraordinary and unique, because we haven't heard that much talked about in the media about how to keep our hands and our masks clean when we're moving. Ms. Tanya, any other comments for the evening before we say goodnight?
I just want to make sure that first of all, I'm honored to have been invited, and I've learned so much from all the panelists. And I know that I just want to add a little bit that there's a lot of information out there on the internet about what to do, what not to do. Use your gut instinct. Use the CDC and the Department of Public Health as your resources. I don't think I can stress personally enough washing your hands, and washing them well in between the fingers, the top of your hands, your palms of your hands. Really get in there and wash and spend a little time in there. Soap and water, don't panic if you don't have hand sanitizer. Soap and water is probably even better for making sure that you're getting rid of everything. And to continue to avoid touching your face and your eyes and your mouth. And please continue to practice social distancing. It's painful in the short term, but it's going to help us get through this much more quickly. And it will help us all be able to get back to church, get back to work, get back to our lives, get back to school. And we can all continue to move through this. And we've all learned a lot, I think, from this entire experience. I know I have, and that we'll carry these things with us. In the meantime, while we are social distancing, please take the time to hug up on your children, your family members, whoever it is that you do have with you, and spend this time doing some mental de-stressing. And looking at the advantages for what it is. I haven't played this much Monopoly in my life, but it has been fun playing this and spending that time with my children and my husband. So try to make the most of any of this that you can. I know it is a stressful time for everyone, and I just pray for everyone's health and wellness, and wish you all much success once we get through this and get all of our businesses and get back to work. Thank you.
Thank you, Ms. Danya. I like those first two purple properties before I like the last two dark blue ones. They knock people out on those first two. We also tonight had Dr. Kraft, who's the Associate Medical Director at Emory University. She may have had to pop off. Dr. Kraft, is there?
Yep, I'm still here, and there's not much to say after.
Okay, there she is.
After Danya's excellent recounting. I think my main issues are just look for sources of truth, cdc.gov, dph.georgia.gov. Call the COVID numbers if you have questions. We're doing everything we possibly can in the healthcare system and in the hospitals to make sure we can take good care of you. But the main thing is to do the social distancing so that you can prevent transmission and all the other things that were described with wear masks and hand washing. Thank you.
Thank you, Dr. Kraft. Thank you, Danya, for what you're doing. You're both on the front line of this. Congressman, you're blessed with an incredible panel. Some closing remarks before we say goodnight to your constituents.
Well, thank you, Steve. Thank you. You've done a marvelous job, and your team in pulling this together. Thank you, Steve. It's just been wonderful. We couldn't have done it without you. Thank you. And Dr. Kraft, thank you for all the great work that you all are doing at Emory and in the healthcare community. Nurse Danya Bedell, thank you, and for your excellent remarks. Director Ashley Bell, wonderful. Director Bell has been our longtime partner on our jobs fair. Couldn't have it this year, but we'll have it next year when we get this economy back, Director. And I can't wait to start getting more and more of our people back into our economy and back to working. Thank you, Ashley. I appreciate that. And Labor Commissioner Mark Butler, thank you for your excellent information. I know all the people that heard you are very much concerned about making sure they get their unemployment insurance checks in. You've been very helpful. And to my staff, Chandra Harris, our staff director, thank you so much. And I want to thank my wife, Alfreda, for putting this in my heart to do. You got to thank everybody. This is a team effort, and God bless everybody. I thank you. Catherine, thank you. Catherine is one working with our legislative. She's working hard to get that $35 billion in there so we won't have to worry about people being foreclosed on, whether they got federal-backed housing or the private market housing. That $35 billion will keep our people in their homes, and it will help pay those utility bills to keep their gas and their light and their electricity on. And finally, we thank God Almighty And we just ask in his name to help us. For we shall and we will overcome this terrible, horrific disease to our health and to our economy. Thank you, Lord. And thank everybody.
Thank you, Congressman Scott. Before we say goodnight, just some contact information for everybody in case you need to reach Congressman David Scott. His phone number is 770-210-5073. Again, Congressman's phone number to his office is 770-210-5073. You can also get information consistent with what you heard tonight at davidscott.house.gov and on Facebook, Twitter, and Instagram. All the handles are the same, at Rep. David Scott. Thank you for joining us this evening for a town hall with Congressman David Scott. Again, to contact Congressman's office, dial 770-210-5073. Thank you, everybody. Have a good night.